Hello, welcome back to O.M.A Medical Studio. Today we are here again. These faces are familiar faces. I mean, all of you guys have seen these people before. So we have Dixon, we have Mr. Nathan, and then Charlie, your name there is the mention.
I am Robert.
Okay. You know go mention the other one.
You can call me Noble Obadiah for long.
Okay. Next time go hold your mind. All right. So um, this is going to be a very interesting episode. Last time we spoke about cholera, we spoke about the causes, the risk factors, and also the what makes people vulnerable to it, and then the areas of the country that are really what affected. Now we want to discuss the current trends, what is happening now, what, which people are affected more as at now, the regions that are affected, the numbers we are recording, and the future. What do we need to look out for? You understand? Then we get to compare to the previous data, previous recordings we have had. So that's basically what we are going to do today, guys. So I mean, we have seen, we are still seeing how the progression is going. Do you think like we are going to survive this? Do you think we are going to deal with this? And then why and how are we going to deal with this kind of thing? Comparing things to the previous data and then current data, how are we going to survive this kind of
Of course, I'm not going to die out of cholera. I'm not going to die and
thing?
then no. That's not going to happen to me. And most of my people are not going to die out of cholera outbreak. You see, this cholera outbreak, the first case was reported on 30th September. That's when they reported the case. But the confirmed case, the first one was in October 4th, 2024. Over over the years and then the previous outbreaks, Accra had the highest cases, and then central region and some western and other regions. But currently, according to the data I have, as at 18th September
So
2024,
currently it's like about only like only 5 regions or 4 regions affected.
yeah, it's about four regions. I have data on four regions only, where central region accounts for 19.2 of the cases, and then Western accounts for 2.6. However, the figures for Greater Accra and the Eastern region is quite unclear um, as at now. So I can conclude from here that Central region now is the region with the highest cases at the moment.
Have you the thing start from this one?
Yeah, I want to ask a question that I think in all the regions, Greater Accra has the largest number, right?
Yes.
So I was thinking that maybe where the numbers are large, maybe that is where
The cases
will
will
be
be high.
will be high.
But the cholera where is start from?
Yeah, it started from Greater Accra region.
So me I figure it be Western.
No, it started from the data I have there. It started from Greater Accra region.
Okay.
Yes, it started from Greater Accra region. Yeah, yeah. But I think they traced back. So I think after Accra incident, the next case was in Eastern. So there was a survey that happened in Eastern that okay, so why is there an outbreak of cholera in Eastern region? So I think after the survey, they realized that the people that were affected, they realized that their water that they live on, their water as they have, yes, the it's not clean, as you all know. Their water is made up of hygienic. It's not hygienic.
Why people they shit for inside?
Yes, and they have free defecation too because of lack of
Appropriate
toilet facilities. So they have open defecations outside, and their waters too are made up of unclean wells, boreholes. You get it? So the survey actually realized, okay, so this is actually the cause of the outbreak of cholera in the eastern region. You
So
get it?
basically, it's tracing back to what we spoke about concerning the cholera overview, where we spoke about poor
Patient,
sanitation,
yes.
lack of proper
Drinking
drinking
water,
water, and all
personal
this.
hygiene, poor
Okay.
personal hygiene. Yes.
And basically, this is not the first time cholera is occurring, so I'm not sure this is the first time we are talking about these preventive measures. So, like, why? Why do we still why do we still keep on recording cases? is it not possible that we kept the situation, we kind of eradicate cholera from the system, that where every year we don't need to, I mean, basically every year we are recording. Yes.
Yeah. Every year, as the case, there's an outbreak of, when there's an outbreak of of a disease, government actually try to put measures to try curb the condition, either to prevent or control it, right? Yeah, there are conditions, there are measures that were kept in place to prevent cholera. But you see, we sticking to those measures. The thing is, do we stick to those measures? Just like, let's take COVID-19 for instance. When there was an outbreak of COVID-19, they told us to put on masks, social distancing, right? You sanitize your hand wherever you are. The thing is, did we adhere to that? And if yes, how did the COVID cases go? So if cholera, they are telling us that the number one cause of cholera is actually poor sanitation, lack of good drinking waters. Have government kept in places? Have government, like I was making a
As
reference
for
to,
good drinking water, once I forget.
you said I was making reference to the eastern region, the eastern side. Um the survey, after the survey, they realized that these people had
I still
unclean
read
wells.
here. The water is difficult.
Yeah,
Drinking
unclean
water
wells. They have unclean wells. They have open
water
defecation.
is difficult.
So the thing is,
Then time as fuel. The water really soft. It be like tea. Go fit buy bread, tea bread, and just be soft like
so you
that.
just add sugar.
So like you still reaching the water dey
Yes, that is it. Have government kept in places? Have government kept those measures in places? And if yes, are we the individuals? Are we adhering to those measures? Are we adhering to those measures? It's a general question, and the viewers as well. And the viewers as well. So
This
it's
one Anita go answer.
yes.
Today you will buy it, you go answer it. So this thing is
I,
saying
I think thank you very much. I think most of the Ghanaians people are not adhering to take part in the measures that the government is putting in place. So I think we need more education on that. Yeah, because in the eastern region, part of the eastern region like this, we have some villages nearby whereby uh, when it gets to dry season like this, yeah, water bodies get dried, and then they try to dig some boreholes around the riverside, riverbanks. And sometimes you may see some cows, sheep, goats going to the
Yeah,
borehole
that's I
to
can I
drink.
can relate.
Yes,
From where I come from,
yeah,
in the dry season, you will see that all water bodies are being dry off. And where I come from, we use wells and boreholes
ready.
from northern region. I come from I will not know. I will not know. Yeah, I will not know. Yeah, there's one of the record about me
Be
not
proud
know.
of your
I'm proud. I'm very proud. Telling me I will not know.
oh yeah,
100%. So where I come from, what happens is that in the dry season, we use boreholes and wells. But you see that time the boreholes, the wells, they also try to dry off. So the river, there are isolated places that there's water, clean water comes out from the ground naturally.
yeah.
So that place
Some comes from the rocks and
rocks very
yeah,
good. So during dry season now, there are kettles around. These sheep are around. Now that place, no, for human beings to that water body is meant for human beings to survive. But this is the time where animals also need water. So you come and see that all those places that those naturally allocated places that water actually comes out from the rock and from the ground, that people survive on. You come and see animals also
also drinking from it.
drinking from it.
Yeah.
but see, this is the issue. Do you think, you see, we've spoken about government measures.
Yeah.
We've spoken about citizens not adhering to the measures. So this particular problem, this particular thing you said, do you think is a problem of the government or of the citizens? Is it the government that has is it that the government has put in measures as to how to care for these kind of things, and then the citizens are not adhering to it? I mean, people rear cows and cattle and
I
all of
think
that.
I think we have poor education on those systems. So we need more hands on that, so that whenever we get into that situation, they may also we should remind them of maybe how to handle their
So
water
while they rear
bodies.
cattle,
Yeah,
then dry season comes. Animals need to go and feed. And you know these people, they don't regulate them. You see
move
them in
around
people's
freely.
farms. And
yeah.
how do we as citizens care for some of these things? Should we have do we have regulations that's probably backing this kind of things, like okay, people send their cattle to people's farm to rivers and for these animals to defecate into them and all of that. Do we have set down rules that put these people in order so that these things will not be repeated? Because I mean we can trace these things and be like some of this attitude and act are the causes of this kind of outbreaks. Because water contamination, a whole lot of things do occur about poor environmental sanitation and all of that. How are we curbing these things?
So that's why I was saying that we should have a good sectors like organizing how let me say
Communal labors.
communal labors and all that. You understand?
That thing in the way.
Oh, some
Yeah.
people, some
Yes,
places it works. Some
Maybe the
places,
villages, oh,
no, not really the villages, only the villages.
you make know, I would.
You understand? Not only the villages. Some part of Eastern region like this. I'm from Eastern region. You understand? So some part of Eastern, not typically village.
You
You understand?
communal labor dey.
Oh yeah, it's working. So we should have good leaders.
Then time then I did class grade in my village every Sunday morning. You go come put your broom for the road side,
Yeah,
the end of the road.
yeah.
Then around 8, we all go sweep from one end to the
The
other
other
end.
end,
Right now,
yeah.
you know the road. Who go do am?
That is why I was saying that we should have good leaders or education. You understand that they should be reminding them of that for on that.
But
So
do someone have the numbers like when it comes to the numbers of the outbreak? Like I want us to look at something.
I don't have the numbers here, but as we are looking for the numbers, I want to chip in this one. Um, I, I believe that with regards to health education, I think Ghana Health Service has done enough. I
okay,
believe Ghana Health Service has done enough of education. You see, these preventive measures for cholera, they are similar for most other diseases. These ensuring personal hygiene, environmental hygiene, um, getting rid of flies and other stuff. They are the same measures for polio. If you want to prevent poliomyelitis, you need to do all these things. You want to prevent typhoid, you need to do all these things. So we've been hammering on it whenever an outbreak occurs. And then I believe the public health nurses are also they are doing their jobs at the chief centers, give health educations at churches, among others. But there is a problem with we the citizens. Adherence is key. Adherence is key. Even if we are not educated at our churches and then at our schools, now everyone has a phone. Everyone,
not everyone, no.
almost everyone.
Almost yes.
Even a child of about 8 years has a tablet. Parents have been buying these things for their children. As much as we care about them enjoying life, we need to care about their health as well. Giving them these phones and then giving them rules, regulating them how when to play games and other stuff. We can also impart into them how to prevent some of these diseases. Also, some people play their role very well. They ensure good personal hygiene among others. However, you can always not cook at home. One day you get outside and go and buy food. But the food seller, how did she handle the food? How did she handle the food? Is it cold or it's hot? If it's hot, you are somehow safe. But if it's cold, sometimes you see these food sellers. Time you get there, you see lots of flies. These people, I say these people,
So
these these
Oh no no.
these organisms, they they do more than 60% of tra- transmitting the disease. So we need to get rid of them. If we can't, we need to control their presence in our societies. So adherence is
Let
key.
me chip in this
Yeah.
one. From here, this one is from Chat GPT. Oh, WRG. So as of January 1st, 2025, the western region of Ghana has been the most affected by the cholera outbreak. The most affected. As to whether the death rate or the number of cases recorded, it wasn't reporting the highest number of mortalities. Okay, so they stated it. Since October 2024, healthcare providers have approximately identified 4,155 suspected cholera cases nationwide. In response to this, I think that was where the cholera vaccine was initiated.
Yeah.
Right from November 30th to December 3rd. Do you think from November 30th to December 3rd, how many people do you think? Yes. Do you think the time frame and everything, was it okay? Was it short? Like,
Yeah, the time frame actually, what I'll say is very, the time frame is very short. It's very short.
considering
Our population, yes,
sometimes people they work, we go meet them.
yes.
30th to
Time frame is very short. And I have, apart from your question, I also have another question. This is a
No,
general
me, I don't know
question.
this question.
Yeah.
I just did ask like
Okay.
30th September. No,
30th
November.
November to 3rd
3rd
December. Yes.
That's like from all.
So the time frame is very short. It's very, very short. You
But
see,
well, again, we can dependent on the number of people being there. Very good. How to strategize.
yeah. No, but what I'll say is that at least every region has a health center, right? Every region, every sub district has a health center. So at least you can allocate every region or every sub region. You can allocate the health. You can tax them.
Should there even be a time frame?
There shouldn't be a time frame.
Like say we are doing it from this date.
There shouldn't be a time frame.
Yes.
Yes, until the condition is or until the disease is cured, there shouldn't be a time frame.
But that's you never reach your objectives if there is no time.
Oh yes. And then we cannot vaccinate people who are already affected.
Good,
Mind you.
well noted. But the vaccination was done. Um, it was done between which ages? From 2 years and above, right?
Yeah.
From 2 years and above. Yeah. So from 2 years and above. So let's talk about those who are below those ages. What's the probability of them also getting the condition or the disease?
You see, the issue is that when children are usually immunized right after birth,
Yeah.
up to I think 5 years of age, where they get their last dose of vitamin A.
Yeah.
But they often visit the child welfare clinic, then they get immunized.
Yeah.
These vaccination that are given to them, there is one called pentavalent vaccine.
Okay.
It contains five different vaccines which curb diseases. So it's assumed that children of 0 to 2 years, they are strong enough, they are well immunized against these diarrhea diseases and other stuffs.
Okay.
So that's why the focus was much on above 2 years.
Above 2 years. Okay. Okay. Then it's well understood. It's well understood. But the aged two, what about the aged two?
Yeah, so they said 2 years and above. So
Yes. So that's what I was saying. So the aged,
I think the cutoff point is around 64 years.
around 64 years.
I don't know. I don't know how how correct it is.
Yeah.
The cutoff point is at some. I don't know if you must before you get yourself.
But this vaccination, was it nationwide or it was at the affected regions?
That's another thing. Yes. I think
I think it's only the affected areas, yes.
health is not what we think.
That's what I think.
We should be able to find out how to do nationwide.
Why?
Yeah. But the launching system for the vaccination was done.
Yes, for them. For them.
Ghana yourselves.
Yeah.
So I think that it should be nationwide because the vaccine it should be nationwide.
It should be nationwide, right? But was it to
But
every region?
my issue is not even the vaccination. See, this vaccination do not put you
100%.
it doesn't make you a herd immune.
Yes.
Like it doesn't prevent you from getting the disease. The vaccine is not a substitute to preventive measures. So the fact that you have been vaccinated doesn't mean like you should stay like
Sedentary lifestyle.
no, you will get it. You will get it. So whether there was a launch or nationwide vaccination or something, I think the grassroots causes it's not people who are not vaccinated.
Yeah.
So probably the government, the stakeholders involved in curbing some of these situations should rather focus on it. See, we are in a country where everywhere is dirty.
It's dirty.
You have people who have sacrificed their time to clean up the city and cars are knocking them down. You don't even care. This bus stop, you don't even care. So I feel like the grassroots causes should be addressed. And see, it all comes down to leadership. You go see people at the past the back here, the last 2 days. Hey, I see some gutter here above. The bottles we dey inside, the dirt, the about all these things. The government can bring millions of vaccines, millions of medications. It was so outbreak was so.
I want to ask a question. What did you do about it when you saw it?
As a good citizen, as a patriotic citizen, what did you do about
It's a
it?
question. What did you do about it? Or it just passed?
About the gutter you saw that wasn't good enough, so filthy.
Me feeling that
And as
Yeah,
a health worker,
you see, this is not even supposed to be a matter of health workers. See, at the point where I felt bad about the situation, means that me, I won't even do that. Like, I won't do such a thing. So, and it wouldn't take me alone to get off it. I can even do it that day and the next day it will be contaminated. So that's where the education to come. At the end of the day, you won't see like any particular person dropping it into it at that point. I saw it. So who are you going to talk to? The next question you ask yourself is probably how are these people dealing with some of these things? So maybe me as a health worker, when I get back to my facility and then I'm advising people on cholera, then I can channel some of these preventive measures to them. But as to whether they adhere to it or not, I'm not the one who is supposed to tell them. It's the law enforcers. What's the community do? How are the community leaders enforcing the laws? What's the punishment for people?
so I think we should implement and reinforce
The laws.
the laws. You understand? The olden days like this, the communal labor, we should reinforce
You
it.
see, forget this communal
So if you
labor.
don't-
If there is no, if there is
At
no
least
debt,
we should,
there wouldn't be any need for
only for
communal labor.
yeah.
So we should probably have set down rules for this kind of things.
Yeah.
See, if we see you dumping this particular rubbish to this appropriate,
You will
place,
prosecute
this
it.
is your punishment.
Yes.
And there shouldn't be anyone coming to say, "Oh, this is my son, this is my daughter." So because of that, he has wanted forgive him. No. If you're able to do all of these things, see, blacks, we dey defend foolishly. Like somebody go do bad thing, then another person will foolishly defend them in the name of I know this person, I know this. But if you allow the law to take its course, you'll see how the country will be. So imagine that, see, every household where we have a gutter, we have allocated leaders there. We have made sure that those who have the gutters in front of them are solely responsible for how neat the gutter will be. I mean, you can argue that the gutter starts from somewhere. It's the same way we allocate those people over there. So if this gutter has dirt in it for this particular time, this is a punishment. Then time we used to have tankers.
I was about to ask, tankers following.
It's not town council. Town council. So town council. Town council. Yeah. And they call it
Tankers.
No, they don't say tankers.
town council.
Hey,
So,
no more
Yeah.
good though.
yeah.
Oh, in the olden days, in the olden days. Hey,
You do health
if you
inspection.
don't weed around your house and around your environmental inspection, yeah.
More like the environmental agency, they are sub.
So when they come around and they see that your area is dirty, your place is bushy and all that, they will arrest you. Oh yeah. Yeah, it's true, it's true. Yeah. Even the place where you dump your rubbish, the place where you dump your rubbish to, it has to be neat.
So what happened to this?
They are there, but I don't know what they are doing now.
Is it that the government isn't paying them enough? Is it that like why? Why?
We need to be forced. You understand that we need to be forced because I think we are sleeping on certain things, and
So is the government
the
still
government
above those
has
agencies
to.
or councils?
How would we are recognized?
I said
It's a government agency.
It's a government agency. So why have
Yeah.
it been dissolved?
So
Or why is it?
they need to.
I'm not sure.
They need
I'm
to.
We
not
don't hear
sure
of them again.
We don't have it.
Because this is my first time of hearing that
Because
town
of the
council.
government.
Yeah, this is
You
my
never heard
first.
of Tangan
This is
before,
my
this
first
guy.
time.
Really?
Yes. No, this is my first time. of hearing that.
Really?
Yes. Why
Wow.
are you in the Zoom lion? That's all.
Oh. So I think the if the government implement the rules and regulations, the leaders up there or out there has to do something. But I think they are not doing their job well. That's how I feel or I can.
But see, cholera is one issue. It's one issue that is very, very deadly. Okay? Cholera. Me, I always say that when I'm attending to I always say that diseases that will make you lose water are the most scariest kind of disease that will make you lose water. See, if you vomit once, you see how like
You
light you
become
become.
weak,
Get
very
it?
weak. Yeah.
So it's an issue, and it's an issue you can't when you get it. Going to the hospital becomes an issue. Oh, Benyango.
Yeah.
Like, excuse me to use that way. So, and sometimes when people even go, for them to even say their symptoms, sometimes they hide them. You get it. So, when it comes to rules, regulations, laws, preventive measures, trying to protect you against these kind of things, Charlie, before we go ahead one. And I feel like our society is so corrupt, our environment is so corrupt, like everything is
It's
corrupt.
corrupt.
Like we just in a country.
And no one is talking about it.
See,
You
Accra
understand?
is supposed to be the neatest country. I said the
But
neatest
even
in Ghana.
some place like Accra, some places the place is very neat. But sometimes when it rains heavily, it drags those bad rubbish and all that.
So
Those
those places that the rubbish have been drawn from, what are they doing? What are those people doing? What are they
But
doing?
every year video,
they okay, yes.
see,
So is it
Accra is dropping him flag workers.
Yeah.
Him
Oh
flag
yeah.
workers.
Yeah.
Oh, Accra is
Yeah.
okay, you want forgive me.
So is it so listen now, is it like the government haven't doing anything or the government have done something, but the citizens
That was what Eben was saying, that it depends on the citizens.
Me, I feel like sometimes the government is not helping. As they talk about every rainfall, flood the okay for Dansuman,
That's
that
why
main road, highway, Dansuman, yeah, Kaswa,
that's why
Dansuman,
yeah.
especially Dansuman Junction,
Junction.
like first light.
Yeah.
I've not seen any government intervention as to that particular flooding that occurs every rainfall. So if you are in a car to alight at Dansuman Junction, if it rains, small drops, you have to get an alight. They can take it to the
So is it that they have to enlarge or expand their tunnels or what?
It.
Yes.
They
Their
get
tunnels,
choked.
yeah.
And basically, you just so Charlie, so my issue and concern now is now we've gotten to know that the Western Regional Report has had the highest impact, and we can basically going back to previous recordings, if you realize that Accra consistently has been the city or the region leading when it comes to this kind of cases. I don't know about now. I don't know currently the numbers Accra has recorded, but see, it has the tendency to overtake Western because of the number of people, the crowded situation in Accra, It's very serious.
I think currently Accra has recorded 258 cases so far. So far, they've recorded
Oh, I wish we
200.
had the facts and figures.
Yeah, I have it here. I have it here. So
Yeah, yeah, and they don't.
Ministry of Health.
Yeah,
I saw something like that here. So
But viewers, see, this is a situation we've all been trying to curb. You understand? So I I feel like the preventive measures are the most necessary things we need to do. The personal hygiene, drinking good water, proper sanitation, that's environmental issues when it comes to the environment. We not like you even go to a particular house where you have people defecating just at the back of the house, the backyard. When a behavior be so annoying, like blacks, when a behavior be so annoying. Even if someone faults and you want to just correct the person, they feel like it's not. What is your right in that?
Human rights.
Forgetting that right comes with responsibility.
Very good. That's what Ghanaians have forgotten. Uh-huh. If you are not able to perform your responsibilities,
Why do you
your
want to
right,
enjoy your life?
your right,
So me,
can be taken away from you.
probably in me, let's summarize this whole thing and advise you. So let's talk about
So I think as we already discussed about, I think we should do reinforcement on how to handle our environment such a way that it won't cause any problem for the citizens or those living around. And I think Eben was saying something that they shouldn't defecate around at the backyard or something like that. You see, in the olden days, let me go that way. The olden days, because I'm part of it. Um, some part of it, I'm part of
someone
it.
said
Yeah, in the olden days.
that
That, yes, man, me bro. So I think we have organizations whereby they go around educating. When I was in ESS, they have been coming each and each day. They have been going to the villages. They have been going to the cities, schools, churches, and let me say some gatherings. They have been going there to, educate people on that. So each and every day, everybody is out. They are on awareness that, oh, if I do this, whenever they see me, they will punish me. So I don't have to do it. I have to go to the right place. And at the same time, I think each house, each house must have a toilet.
oh, but that thing government starts
No, it's not working. It's not working. It's not working.
well, yeah.
each house should have.
It's not working because I once saw or heard, even I saw some. They distributed the how do you call it, the WC, the items, but they didn't come again for the installation. You understand that? They didn't do any follow up.
No, but then
So
once you feel your mouth against a person toilet, yes, I'm family.
no. They didn't. They brought the items. You understand? But they didn't come again to teach them how to do it. You understand that? Some are there right now.
Health should be personal. I mean, that's all.
Even
If the
I
government,
don't know anything about how to the installation, how to fix it, how to go about.
okay,
They just
so
brought it. They came for a survey to look to look at the place
where did they
have
give out toilet
yeah
equipment facilities like
yes
WCs were part and all that?
yeah. They brought no they what the way how to
Install.
even dig the this thing. You understand? They didn't even teach them anything like that. What is you know no Amy, no, the tools that they brought is different from the ones that we are
Ordinary
using,
ones.
normal ones that we are using. You
Okay.
understand? So they brought the instrument, but they didn't teach them. They didn't come back to teach them how to go about.
If I was to be one of those people who receive those tasks, I would make research. I will contact
No,
people who are into
the places where
construction.
they distributed those things, the villages, how they are uneducated. So how will they know how to make research
Me,
on those
me
things.
see. Let's
It
even
depends.
forget
It
about the
depends.
situation of having WCOs and see.
Yeah.
Those days they were not
I know
those
you
days.
too.
This kind of preventive measure just has to do with appropriate damping.
So it shouldn't come closer to the house, or it shouldn't get
Yes.
near to the house. It should go far away. You understand that? Because I was
Ac-
once
Accra, Accra,
handling such an a
Accra,
toilet
Accra, we are
before,
talking
because
about
we dug
having recorded the
a pit
highest cases.
and we put some
that-
wood on it, but it's far from the house. Yeah, beating. It's far from the house.
You ever hear somebody fall for inside my town?
Oh, we have been
Yeah.
falling.
And then you
And
go
then whenever you fall into it, they will bath you at that side. They won't bring you to the house. They won't come to the house. Then after that, they will give you one egg.
Sure. No, you go pay
Yeah.
that.
Yeah.
If you don't pay that, you go pay
Yeah,
that. So
you go
what
pay.
you say you be law. Maybe them indicator now you can't make you go inside and somebody know toilet can come be am you just go to the
I was making some. I was trying to give advice on how to handle settings. So I think we should do. I was saying that we should do the reinforcement. It should be forcible to
Okay, so
let them know what is good and what is bad. Yes.
I want to just chip in this one. I want to make it quick. Um, we know the affected regions: Greater Accra, Central Region, Western, and the Eastern. Brown and Hartford. The other region, I don't remember the new regions. Northern, Upper East, and you've not you've not recorded cases. We understand you, but please take the precautionary measures. You see, we have asymptomatic carriers. They are people who have the disease, but you do not see them exhibiting the signs and symptoms. However, the positive organism is still in their GIT. They excrete it through their feces. So you have a chance of also getting it. We have some people who do not exhibit the symptoms, but they can transfer the disease for more than 7 days. They can transfer the diseases. So you need to be very careful. Even though we've not recorded cases in our region, there may be someone who has it. So try, and then take the precautionary measures. Let's get